Good evening, this is my week 6 video submission for my midterm. Here in front of me I have the screening forms, the requisition, and the standard card. I will also be reading the questions off the screen. And let's start with the first question. It says, patient Sean Kim, male, date of birth, 7/21/1994, has arrived to the department and is scheduled for an MRI brain without contrast in the 8 a.m. time slot. And with 1.5 Tesla scanner at your site. The scheduler has also scanned the implant card into the system to view the implant card. Look at the order and explain if it has everything you'll expect to. So I'm reading the MRI acquisition. I see the date of birth is there, first name and last name, the doctor's signature, the modality, the anatomy as well, which is the brain, and it's going to be without contrast. And the reason why the patient came in to get the MRI is because of a headache. Any other things that I see here? Surgery, no surgeries, because the surgeries are very important. Put the patient in the scanner. We need that extra information. And as I'm reading here, he is diabetic, but since it's a no contrast exam, we wouldn't really worry about that unless the patient has a glucose machine that gives some insulin. The insulin pump. There you go. The insulin pump. Also, right here says possible contraindications is highlighted that coils, filters, grafts, and stents are highlighted. And the nurses already provided me with the stent implant card, which is a Cobra PCF. I do see that it's MRI conditional, meaning that it needs to meet the criteria of the MRI scanner in order for us to scan this patient. So Cobra PCF, I checked the site, it's clear, good to go. I double checked with my radiologist, it says good to go. And I also checked MRI safety. If anything, I will. But it's MRI condition, it's good. Let's see, it says, look at the implant card and explain any concerns you might have. Like I said, MRI conditioning was the concern that I had, but after reviewing the website, I confirmed that it's good to go. And in the third one, it says, walk through the steps you will take to get the scan room ready. Be as detailed as possible. We'll start with washing my hands, proper hygiene, switching up pillow cases, blankets, position. The coil, if we have that in handy, just have it ready. Once we position the patient into the MRI scanner, we'll integrate and combine all these items together to situate them. Now it says, besides that, make sure there's nothing on the floor, everything's clear, and let's go get Mr. Kim. Okay, I'm gonna go to the reception area, and it says walk through everything you'll be expected to say and do in this scenario. He doesn't ask many questions, but he understands you. He is able to ambulate without assistance. So I will use aided to acknowledge. I will first start with first and last name, and his first and last name is Kim. Is Mr. Sean Kim. And so I acknowledge Mr. Sean Kim and say, hey, Mr. Sean Kim. And I just confirm his date of birth, which is July 21st, 1974. And I tell Mr. Kim, hey, Mr. Kim, what brings you in today? And he's going to tell me that he's having headaches, and that's the reason why he's coming in to get an MRI. And then after walking him to the reception area, he hands me his screening form to view his screening form. So I have a screening form right here. So as I'm walking to the locker and changing area, I am going to be reviewing his screening procedure, and I can already see that there's some things that are missing and improperly marked. So I am already at the locker, so I'm gonna explain Mr. Kim. Mr. Kim, do you have anything that any type of medals that you were born with? And he's gonna tell me that he had the surgery for the stent. And I already made note of that. We're already aware of that. And I asked him to remove any personal items that have metals in them. I know some MRI students like to leave like jewelry, like gold, but since I am a student, I'm just gonna wanna try to be safe and sorry, so I'm asking to remove everything if possible that he can remove and change him into a gown, because if he doesn't get changed into out of his public clothing, he can have burns. And there, he follows you to the instructions exactly and follows you to a more private area where you can complete the screening process. Look at the screening form and review with it. So, Mr. Kim, good morning. Today's date, let's see, I'll write it out for you. Alright, we are October 20th, 5. Your age, sir, you were born in 1974, is that correct? Okay. I see, I'm going to write 51. Okay, just want to verify your address, sir. It's 555 Wilshire, apartment 55 in Los Angeles, California. Good, and you say you came in because you have headaches of your head. All right. And your physician, Dr. Cohen? Cell phone is down. Now, Mr. Kim, have you had any surgery of the body or head before? No? Okay. So I see that he marked no. Have you had a previous diagnostic imaging study or examination? No, it's your first time? Okay. Now it says, you left two questions unmarked, sir. Number 4, it says, have you had an injury to the eye, immobile metallic object or fragment before? No? Okay, Mr. Kim, I'm going to mark no, okay? Now, number 5, it says, have you ever been injured by a metallic object or foreign body? Have you? No? Okay. No. See, okay, medications, reactions. You did mark, do you have diabetes, sir? Okay. Well, luckily for you, this is an MRI without contrast, so we won't be worried about that. However, if you do have an insulin pump, I will have to ask you to remove that. But he doesn't, so. But in case he did, I will ask him to remove it. Let's see. I see for female patient, I understand that here's an X. It doesn't apply to you, so I'm just gonna write my first and last name. And can you please also just initial your first and last name? Okay, thank you. Now the next question says, please indicate if you have any of the following. You left leg implanted cardiovascular defibrillator and ICD. That is a no, because you have a stent, sir. Let's see, another question left blank. You said, did I understand your market? Thank you, Mr. Kim. Let's keep reading. Are you here for an MRI examination? Obviously, yes. No, it says dental implant, Mr. Kim. So for the dental implant, most modern implants are made of titanium. This one can't be removed, unfortunately. So for Mr. Kim, he's good to go. Let's say I called his dentist and just verified that the dental implant is non-ferrous and is made of titanium. It might have some small artifacts. In that case, we are gonna probably place a bandwidth with the oral area. Now, Mr. Sean, signature person completing the form. The patient. I need your signature, Mr. Sean, please. Thank you, thank you. Put the date down. You came by yourself. You have no one with you. Signature. I reviewed this. We're ready to go. Mr. Kim, your screening form is complete. It says right here. Is there anything on the screening form that concerns you? Went through that. We have to gather information. No. Fill in any areas that do not look completely accurate. We did it together. When Mr. Kim is ready, welcome to the scan room. Set him up in position for exam. Explain every step in detail as if you were walking through the process. Alright, Mr. Kim, I am going to place you in the MRI scanner. You're going to be going head first, supine position. I will also be placing this coil around your head. It's that HD transmitter channel coil, and it will be going on top of your head. I will apply some extra comfort and some headphones, so you won't, so it won't be too loud and you'll be very comfortable. If you have any questions or concerns, do let me know. Just press the button and I will communicate with you. Follow my instruction. Every scan is slightly different, but the fundamentals are very similar from the site. You start scanning and your scale images look like that. Okay, explain how you will plan your axial images, your sagittal images, and coronal images. Be as detailed as possible for each one. Once they are planned in this scenario, copy the coverage and keep scanning to a pro. To Mr. Kim, I'm also going to apply some extra comfort pads under your legs so you can be comfortable for the scan. Let's see. And now I leave the zone 4, go into my scan room, and I'm communicating with them, and I run my scout system, which shows the 3 planes: sagittal, coronal, and axial. And the way I will plan a sagittal image will be on a coronal and an axial, divided both hemispheres of the brain. And for a coronal, I will plan it on a sagittal image, parallel to the stem, the brain stem, covering. I'm sorry, for sagittal. Go back to sagittal. I'm gonna cover the whole head, temporal lobe to temporal lobe. And for coronal, like I said, we will do it on a sagittal image, and we'll put it parallel to the brain stem, covering the frontal sinus to the occipital condyle of the head. And on an axial image, it will be on a sagittal, so it will cover from the genuine splenium of the corpus callosum, and make sure we get the whole brain in, like front to back. And now it says, if possible, what will you say to Mr. Kim on the intercom? Between sequences, I will communicate, Mr. Kim, thank you very much for being still. We will be finishing, we'll be wrapping up soon. And I thank you for your patience. Make sure we have to communicate with Mr. Kim, because being still for so long is very uncomfortable, and just one slight movement can just ruin our images. So now it says the last sequences finishes and the images are good and free of motion. What steps will you follow as you escort Mr. Kim back to the changing area? I will tell Mr. Kim, hey, Mr. Kim, thank you very much. We are done. I will properly. He's ambulatory, so he can pretty much get up himself. He gets off the bed. I walk him to the locker, hand him his key, his items, changes out, and he's off to the front. And I will tell Mr. Kim. And if Mr. Kim tries to ask me any questions regarding like the exam, like how it went, like what do I see, I will have to say like it's up to the radiologist to interpret it. And at the end of the day, the medical doctor will decide what the pathology or what he sees in the scan. So try not to answer any questions. It says, when this is part, what steps do you expect to follow to complete the exam? Like I said, this needs to be sent to the radiologist, the information to the radiologist, and they will interpret it, and then they will follow up with Mr. Kim. And then when I go back to the exam, to the MRI exam room, I will sanitize, clean everything, and put everything back in place and have it ready for the next exam. And that concludes my video.